This is ECG exercise number 22, and I'm sorry, I just can't recall what page it's on now, but in any case, exercise number 22. Now, it's a bit of an interesting rhythm here. First, again, we want to interpret the underlying rhythm and then describe the FLBs, and these being the FLBs along here. So let's start with the underlying rhythm, which is approximately 126. So the patient's on the tachycardic phase. In the underlying rhythm, the P waves are present, but there are no P waves associated with the funny-looking beats. And the PR interval is 0.16 second, which is normally underlying rhythm. The QRS is narrow, except where we see funny-looking beats, and there they're wide. So keep in mind that the funny-looking beats are wide, and they don't have P waves associated with them. So if they're wide without P waves, they're premature ventricular complexes, right? So the ratio in the underlying rhythm is 1:1. The rhythm is irregular. I mean, the underlying rhythm is regular, but then it's disrupted by these premature ventricular complexes. And when you see two premature ventricular complexes side by side like this without a sinus beat in between, we call that a couplet, right? A couplet. And when you see three or more ventricular beats side by side with a rate at least 100 or greater, we call that a run of ventricular tachycardia. So we have a run of VTach or this end. And the heart rate here is 300, 150. So we have a VTach with a heart rate of 150. And we have a couplet over here. I'll just, oops, that's supposed to be a U. Couplet. There we go. And so the interpretation here is a sinus tachycardia with a heart rate of 126 with a couplet and with a short run of VTach. Now, the important question here is, number one, how often are they having couplets? How often are they having runs of VTach? How long are these runs of VTach? This is a relatively short run of VTach, but are they having longer runs of VTach later on in the course of your assessment of the patient? And are they symptomatic with these couplets and these runs of VTach? Are they having dizziness, lightheadedness, nausea, vomiting, shortness of breath, chest discomfort, syncope, because sometimes patients will have syncope with short runs of VTach, just as they might with sinus arrest. And then the big question is, why are they having so much ectopy? Is it because there's some underlying cardiac ischemia that needs to be addressed? Is there a volume depletion issue that needs to be corrected with volume resuscitation? And so on and so forth. So interesting ECG here.